I'm not sure how much you guys were able to hear of what Nadha was saying, which is too bad because Nadha has some really good stuff to say. Just in case you didn't hear her previous slide, it was that racism really impacts health in multiple places and settings. And I think we wanted to ground this in, given that the audience is going to be from settings other than healthcare. I think just the main point that Nadha wanted to make with this slide, that most certainly, you know, racism is baked into the very fabric of our country, unfortunately. And so the impact on health that racism has certainly exists within multiple spaces. And these are just a few, including, you know, the digital spaces, our public spaces, our wilderness spaces, parks, transportation, the prison system, social services, educational institutions. And what we're hoping today is to sort of just demonstrate using healthcare as an environment within which we can discuss how racism permeates through and approaches that we can take to help mitigate those effects. Our situation and where we're coming at this presentation is from a healthcare setting, an outpatient healthcare setting, which is our academic family health team. St. Michael's Hospital has an academic family health team that has been in existence, gosh, I think probably since the 70s. And more recently in 2013, a social determinants of health committee was formed to really take, at that time, was a unique look at how the social determinants of health, like literacy, like unemployment, like poverty, how we could start to take a look at those social determinants of health one by one, and how we could start addressing them from a primary care perspective. And how could we, as primary care health practitioners, really start to improve our patients' health by addressing those social determinants head on. While we were doing that, it became obvious to me and a couple of my colleagues that there was one very powerful social determinant of health which wasn't being touched on in a very direct way, and that was racism. And we decided, along with our community engagement specialist, one thing about working as part of a team, a family health team, is that we're really blessed with the resources of multiple unique positions. And one of them at St. Mike's that we've been very blessed to have is a community engagement specialist. Her name at that time was CN Knights, and she really helped push us to really embark on a journey to really look at racism as a social determinant of health in a really concrete and unflinching way. That got started by having some funds from a private donor, a donor who really saw the work at St. Michael's as being something that his partner had really been very committed to. And we were matched with this donor who was really also very inspired by our unflinching desire to really raise racism as a part of our work at the Social Determinants of Health Committee. This funding allowed us to bring on a staff person to help guide and lead this work. And that's where I first met Nadha, and Nadha came on as a coordinator. We'll talk a little bit about this, about how when you put one person with a little bit of time to this work, how it became very obvious very quickly that this was not the work of a 0.1 full-time equivalent for one person, but it's where we started. And the main goal of our work was really to try to put a true anti-racism approach into action in a setting which was outpatient primary care. Part of the reason we wanted to tell this story is, and why I think it's very helpful too, is to talk a little bit about some of the both the success and both also the obstacles that we faced. And I think there's a lot of rich learning that comes from the setbacks, or from the plateaus, or from the unintended negative consequences that this work can come from. And I also think we wanted to highlight too, what are some of the key, I actually think they're almost like key personal values that one must really possess in order to do this work. It takes a lot of vulnerability. It takes some bravery. It takes some determination. because it's not easy work and it requires a real persistence. I love that Nadha put this picture of us up on here, because I think it took a real core group of very dedicated, and I think the word is passionate. I think when you have a passion for something, you continue undaunted. And there are myriad of obstacles in this work, and myriad of difficult situations, and myriad difficult conversations. And we're all approaching this from different perspectives, from different places of privilege. I'll speak to me personally. I came to this from a place of privilege in that I'm a physician, that I yield power in that regard. I'm not an employee technically of St. Michael's Hospital. I don't have I have a boss, a quote unquote a boss, like a director who's very supportive of this work, and is in the culture of our family health team, that the physicians are often well known for being a little bit like rabble rousing and are often encouraged to sort of speak out. Interestingly, the outgoing director of our family health team, Dr. Philip Berger, came to me and dropped off a little article when he found out I was doing this. And his main message to me was speak up. And it's been the thing that I think for me, and I think for our whole team, has been quite freeing, is to begin. It's like we know that these that racism is like a snake throughout all of our lives, and to be able to speak up clearly and to use very explicit definitions and to really name racism for what it is. Just that fact was really quite revolutionary for our department at very early on. We'll talk about this later. We were encouraged to rename our committee instead of the Racism and Health Committee. We were often encouraged to, could we name this more of the EDI, or Equity, Diversity, and Inclusion? Or could we, kind of talk about this more as cultural competency? But there was, some really, I think it's like sort of hard lines that we really held, which is that I thought it was important to be explicit that we're talking about racism. We were quite explicit that we wanted to engage in anti-racism work. And so as an audience member, as you're listening to this, we certainly will be trying to highlight some of these key messages about, but I think they really start from a place of having passion for this work, having a dedication, and really understanding, that it's work that puts you in a vulnerable position. So there really are three issues that we're going to address today, and we'd like to sort of take like an issue-based approach, which is us taking a look at how our work going through this has highlighted some areas that help us tell a story about where the work really needs to be done. Nadha, I'm going to see if your voice is going to be able to come back on. Let's take a look, and let's see if Nadha can tell us a little bit about our focus on our three issues.
Yeah, thank you so much, Yuliya. Let me know if you can hear me.
It's a little choppy, but we'll see how it goes.
Okay, I'm sorry, everyone. Technical issues is just one of those realities of the day-to-day. Let me know if it's not clear, but I will try to speak slowly, and hopefully this works. And so if you can just let me know in the chat if this is working or not. But I think, as Yuliya was saying, we really wanted to focus in on three issues. And so the first issue was about not defining the actual problem. And we'll talk a little bit about what that means. The second one is not addressing institutional racism first, and trying to launch right into tackling sort of personally mediated racism. And issue number three was, how can we move beyond performative actions? Next slide. Yeah, so as issue number one, like I said, not defining the actual problem. And so this unclear definition results in misaligned objectives, right? So it gets at shallow performative activity and not really deep work or deep change. And so in many ways, we made an assumption, like we made an assumption at the beginning of this work that people would know what we were talking about when it came to racism. And I think this can often happen. So remember, this was back in 2017, which I think was a very different context and very different time as opposed to the changes we've seen in the last couple of years during the pandemic. Calls for justice and action against racism, especially in the wake of George Floyd's murder and others like Breonna Taylor. So what we really learned was that failing to clearly define a problem at the outset with everyone involved resulted in actions that are not aligned and don't actually get the intended or the desired outcome. And so some possible strategies, I think, in this situation are raising explicitly, and also starting to think about clear goals, establishing clear leadership buy-in. And so here, I think, in part of the slide, the strategy that we're talking about, I think, the lack of a common goal, but also which tends to be used, right? And we tend to use terms interchangeably. So I just tried turning off my camera just to see if this is any better. But I'll hand this over to Yuliya to take.
This diagram that's being presented on the screen here is from the scoping review that we embarked on at the very beginning of starting this group. When we first approached our executive team, I could see that there was a lot of fear, there was a lot of hesitancy to do what we were initially suggesting, which was to do a survey of our staff and potentially even our patients to ask about their experiences of racism within the department. There was a lot of fear around that, and there was a lot of wondering of like, what are other institutions doing? What is everybody else doing? And so we embarked upon a scoping review. And that scoping review was a valuable activity in that we were able to identify some key lessons from different initiatives that were being embarked upon around the world for outpatient healthcare settings in settings that were implementing anti-racist programs or interventions. And as Nadha was mentioning, hopefully you guys could hear her for that first part. Really starting this work is laying a foundation and defining the problem, setting some clear goals, having a shared anti-racism language. Interesting, when we started our group, we also subsequently developed a terms of reference where we explicitly describe, what is anti-racism? Anti-racism interventions are action-oriented, educational, and they're a political strategy for systemic and political change that address issues of racism and their interlocking systems of social oppression. And the fact that it's grounded in leadership and accountability. So getting everybody on board so they understand that we're talking about not necessarily just the interpersonal experiences of racism, but understanding even just the idea of what is institutional racism. How do we create institutional accountability for achieving racial equity? How do we impact on all the aspects of an organization's work and incorporate racial equity into organizational systems? Honestly, I think we all need to make sure that we have a shared language and a shared understanding of where we're starting. There was also a real tension, and I think this has to be at the outset, that establishing leadership, buy-in, and commitment. I love the word buy-in because it's also really reinforcing the fact that funding needs to flow when you're going to embark on these kinds of endeavors. Laying a foundation for these interventions requires time and effort and the funds that are going to support that time and effort. Certainly supporting the folks that need to be doing this work, bringing in the right support and expertise. Our whole committee transformed as we brought in external consultants to help lead us through this. There are consultants that do this as their life's work, who help organizations really take a really critical eye at, how are they going to set up systems to address issues of racism and to take an anti-racist approach to the setup and goals of in their mandate for their care within their organization. So bringing in the right support and expertise. We're going to need to do, as we go along this work, establishing meaningful community and patient partnerships. For our team, one of the very explicit goals of our team was to really address anti-Black and anti-Indigenous racism within our department. And an example of starting to develop those meaningful community and patient partnerships is that we have made a very concerted effort to liaise with Indigenous elders to bring them onto our, bring their expertise into our work, and have had sessions with Indigenous elders around issues like having more meaningful land acknowledgements. We recently opened a new clinic and have been working with elders to support how can we bring in some traditional medicine practices into those clinics and have smudging, have
attention staff, last call for specimen pickup.
More create more supportive spaces for our Indigenous patients to feel that the clinic is a safe and welcoming space. Based on our so maybe that's what I'll say about this slide. Sorry, we'll go on. The Nadha, are you okay to talk to the second one?
Yeah, so I have called in and I'm hoping this is a lot clearer.
It is, yes.
Okay, perfect. And so I'm sorry again, everyone, I apologize, but as with many things, I think things can and will go wrong, and then you just need to troubleshoot and find ways around it. So thanks so much for bearing with us. Issue number 2 that we wanted to talk about was not addressing institutional racism first and instead focusing on individuals. So I think that there's this assumption that the individual training of employees will result in behavior change and somehow, quote unquote, solve the problem of racism. So this is not to say that we don't want individuals to deeply reflect, unlearn, and do the work of figuring out how to be anti-racist, but rather that within an organization, sort of staff training and the focus on individual and interpersonal levels of racism that are personally mediated needs to happen after organizational level change. And actually, if you start to try to do this sort of individual training, there can actually be substantial pushback, and this can be ineffective at tackling systemic racism. And so a possible strategy and a lesson learned is that staff training needs to come afterwards. And so instead, we need to begin with organizational level and policy level interventions and changes that are first integrated into policies and processes. So I think Yuliya can speak a little bit to what this can look like, and we will bring up the diagram in a second, but really this refers to thinking about strategic plans, terms of references. How do we think about hiring, promotion, and retention when it comes to thinking about racialized folks? And also, how do we think about tackling racism by putting this into the budget, right? Like, we need to actually have the resources, so the staff and the funding to push this work forward, because I think it can often be underestimated. And so on the next slide, we actually have this great quote that was from our scoping review that I think really highlights a shift in our thinking that needs to happen so that we can start to think about this transformation that happens at an organizational level. So the quote reads, individual level intervention should only begin after interventions at the intra-organizational and extra-organizational level have been conducted. And this is because individual behavior is shaped and promoted by organizational culture and practice, not the other way around. And so I think, coming back to the diagram, which is on the next slide, we've outlined the importance of tackling institutional racism first before addressing personally mediated racism. And so, Yuliya, I'm not sure if this is where you wanted to share a little anecdote about the academic family health team.
The organizational level, interventions, there really is, you can feel how there's this, there's a real wanting to sort of plunge into the staff level training. And it almost like sort of requires a conscious effort to sort of help. It really was the leadership see that the policy level was really something that had to be in place first. For us, some examples are that we realized actually from feedback for us, it happened a little bit backwards, in that we got some feedback from our healing circles that we had started after the summer of 2019, yes, it was 2019, where there was a lot of our staff that were feeling just a lot of the trauma from a summer of George Floyd and Black Lives Matter, and there was a lot that was going on that wasn't really being addressed, that was sort of just under the surface. And we decided to implement some healing circles that we brought in a well-trained therapist to really lead those circles in two ways, one with our Black and Caribbean staff, and one with our BIPOC or other racialized staff. And in those meetings, it really came out that the staff were feeling that they needed to have an organizational shift when it came to being able to even participate in initiatives that were related to our anti-racism efforts. And even what are seemingly simple things like having the clerical managers be flexible with scheduling, to have coverage, to really set the tone of showing that the sessions that were being provided to our staff that were related to anti-racist initiatives, that their schedules were going to be blocked for those, that their schedules could be modified in order to ensure that they were able to participate. Those kinds of seemingly small initiatives really spoke, I think, quite loudly to our staff, and are, I think, slowly starting to make it feel like when there's protected time for something, when there's, we made a conscious effort during the formation of our group, when we regrouped and developed what's called the Anti-Racism Advisory Group. We really made a commitment to that group being multidisciplinary, so that it's going to have the voice of all members of our healthcare team, including the learners, including forward facing clerical staff, including the variety of healthcare the variety of practitioners that we have at our family health team, including psychologists, dietitians, nursing staff, as well as the physicians. So that conscious, it was built into our terms of reference that the group be multidisciplinary, that we built this in, that we would have regular reporting and accountability to the exec to really help push. I think that's maybe the part that we really wanted to say, was that there was a lot of push, there was a lot of pushback, and there was a lot of pushing forward to really help our organization see that this level of looking at policy level, organizational level, this is the work of leadership. This is the work of the executive committee of our organization. This isn't the work of a small group of racialized folks. But the purpose of the group, I think, has really started to evolve in that it creates a forward push to hold the team accountable, to provide the transparency and hopefully the sustainability that we'll talk about in the next couple of slides. But we are starting to sort of really put out a real understanding to the exec, and I think there's starting to happen that we're looking at, let's review our policies when it comes to hiring. I've noticed that there's been started to be directed efforts to advertising when we needed a new physician to fill in. There were postings, for example, on Black physicians of Ontario websites. We started to expand our searches a little bit more and be more conscious of how are we doing some of those hiring practices, taking a look as well about how we are responding to incidences of racism that are reported within our department, looking at how can we protect our staff when these incidents are coming from patients. So really bringing this sort of online at an organizational level, it requires ongoing efforts and an ongoing, I think, push, because it's not something I find that, I do find that there is a little bit of like, oh, are we still talking about this again? There can be certainly hot topics, right? Where, where all statements are made when, Black lives and Indigenous lives and, all of the very traumatic things that we hear about when those, when children are being, their graves are being dug up at residential schools, it will become a hot topic and everyone wants to talk about how are we serving our Indigenous patients, or Black lives are lost, and all of a sudden it becomes a hot topic of how are we going to ensure that our Black patients and Black staff are being supported and are being, that their traumas are being addressed. And I think it's the work of an organization to make sure that it's not just a hot topic, that it's embedded deeply within a strategic plan. Again, another work of our group was when we are redoing our strategic plan for the family health team, really making sure that anti-racism efforts were put as a key part of that strategic plan. When you have a strategic plan and you're going into, it's written down as part of the mandate of an organization, that's how you can, again, get that accountability and really pushing. Again, we had some funding that came from a donor, but that money that comes from a donor ends and it puts you in a precarious position. And we really pushed to say, it needs to be an ongoing budget line in our organization. And that this is the work, that this is a budget line that has to come from not, our group, scurrying around looking for ways to continue the work, that there really was a little bit of a handover. It's difficult sometimes when something's been the genesis of a group and a committee, but to be able to really say, here's how we can support you in this work, but that this really has to be done at an institutional level, and to keep it on the front burner, I think, is the work of our group.
Thanks, Yuliya. And we're hoping that some of these examples are really helpful in sort of expanding and illustrating some of these more theoretical issues that we're talking about. And issue number 3 that we wanted to discuss today was really the impact of this work maybe not going deep enough, not far enough, or not quickly enough. And how do we really start to move beyond some of these performative actions? And so as Yuliya sort of spoke about, there's still really fears around doing this work, and it's challenging. It's really challenging work. It requires vulnerability, it requires brave transformational leadership, and it requires building trust. And so often in research, there's this saying about moving at the speed of trust, and I think that is also incredibly important here. At the beginning, we talked a little bit about the context, and I was incredibly excited to come on and work with a group of Black and Brown women who are really spearheading and leading this work. But I was brought on 1 day a week. And so, you know, this was work I was doing sort of off the side of my desk, and there are limited resources. And so I think this is just, part of the problem of folks actually underestimating the amount of work to be done. And the problem with that is that really status quo actions uphold racism, and they uphold what has been perpetuated for decades. And so really there was no perfect path or sort of quote unquote best practice in healthcare. And that's really something, you know, the gold standard that folks within healthcare and public health want to work towards, right? You want to look at what's been done before. And so sometimes when there are processes that we can look to other fields and other disciplines that we thought should be a given, but they're not. And that's because of the context, right? Like organizations are not flexible moving things. They're very, they take a long time to build up and they take a long time to transform. And so another thought here is that there's still limits to critical thought around dismantling white supremacy. And perhaps people are still not convinced. I think that sometimes, even though we are in the current culture that we're in now in the current context, there's this idea that perhaps this will blow over, right? Perhaps this is something that is just here for a season. And that can be challenging, right? It can be challenging when working and trying to move this forward. And so some sort of thoughts that we have around this are really the need for critical reflection and transformational leadership, and some principles that are incredibly important that we were able to identify through our scoping review were transparency, sustainability, and accountability. And those three principles really, I think, embody the importance of kind of doing this in a slow and progressive way, but also ensuring that it's set up to succeed, right, and not to fail. And we can talk a little bit about what that looks like. And so one of the things that has come up is the idea of cluster hiring with dedicated long-term funding and actually ensuring that there are budget items for this work and that it is not something that is sort of an afterthought, but really an intentional process. And the importance of evaluating these processes, because inevitably there's a need to stop, reflect, and course correct as needed. I think that is something that we can all learn to do a bit better in our personal and professional lives. And I think organizations as well need to sort of learn how to build that in, because sometimes it can be easy to keep going and move fast, but I think really slowing down and being critical and being thoughtful is incredibly important. I know on the next slide we had the same diagram, and we sort of inserted these pieces of transparency, accountability, sustainability, as well as evaluation and monitoring as a cyclical process, right? It's embedded throughout this whole framework. And this paper is available online, it's open access. And hopefully, you know, you can take a closer look at it if you'd like to, but really our call here in putting this in was really to advocate and push for that ability to stop and reflect. And so I can just speak a little bit to this and then maybe pass it off to you, Yuliya, to continue. I think there are so many things we could chat about here, but really in moving forward, how can we think about disrupting harmful power dynamics and privilege? And a question I do want to ask is, whatever organization or you might be working in or be thinking about, what is the structure of it? And how is it tackling anti-racism? And is it disrupting the status quo, or is it upholding what has been done for so long? And I think that this work requires sharing space and also sharing power, but that doesn't mean downloading the work onto folks who are racialized. It doesn't mean downloading this work onto Black, Indigenous, and people of color. It requires working in relationship building relationships and engaging meaningfully. And so that again requires flexibility and vulnerability. And we just have some questions here. We just, I think thinking about who gets heard, who has the privilege of speaking up. And I think that again is something within an institution, there is a hierarchy. Who is included? What dynamics need to be disrupted? And something that happened initially was like, this was happening during lunchtime, but you're not paid for your lunchtime. So, who gets to come? Who does this work? And also, meetings generate work, which must also be paid. So thinking about how do we sort of embed that into the processes and thinking about it from an institutional lens. The one other thing I will add here before passing it off, I think, was the setup of how things can inevitably be performative. I mean, in the wake of 2020, we saw an incredible number of open letters that were being written and statements about committing to tackle racism. And as important as it is to note and name racism, I think now in moving forward, how can we start to build in that infrastructure? How can we start to build in that legacy of keeping it going? Pass it over to you, Yuliya.
Yeah, and I think just taking up on that last point about the legacy of keeping it going, the key questions is how do we keep this work moving forward? And that's that sustainability part. I mean, I guess I can't emphasize enough the importance of this having leadership buy-in. When leadership is willing, we talked about transformation. Transformation is when it's a process, right? Transformation is obviously a process, but this is when you talk about implementing an anti-racist interventions into settings, it's about transformation at the heart of it. Transformation means that something is changing. Often people are very fearful of change. They're fearful of their position. They're fearful they'll look bad. They're fearful that they'll be called racist. They're fearful that they're going to have to move over and make space. And when you've been comfortably going along with status quo, that can be difficult. But the process of transformation is it's a process of collective people change. And it's regardless of the role that you're playing. And so whether you're the head of an organization, the cleaner that comes in the evenings, or the person that's answering the phone, or the person that's learning to become a nurse practitioner, regardless of the role you play, implementing anti-racism interventions in an organization affects them all, and it requires the whole process requires buy-in from people. And in order for that emergence, right, transformation means something new is emerging. In order for that emergence to happen, it has to be a shift about what you think is possible, and there has to be a shift in what you think is necessary. So if you have an organization that's like, well, listen, gosh, we've been serving the marginalized and we've been helping those that are, impacted by poverty. And look, we're very LGBTQ friendly. So I don't know why are you guys keep on this about racism? Like, why? There's not going to be transformation. There's going to be resistance. The key, and I think where we're at right now for our organization, is that we've been trying to work, because we're a very big family health team. There's a lot of different sections. We have quality improvement initiatives, we have patient safety initiatives, we have wellness initiatives, and I can see so clearly about how adopting an anti-racist lens in all of that work is key. You need to train the leaders that are involved in those programs so that it becomes part of our processes. It's not a checkbox. It's like the whole list. It's the paper, it's the pen, it's not the checkbox. It's the pen with which you write, is to ensure that an organization undergoes true transformation. And I think those are sort of some of the points that we came out with in doing this review, and what we're hoping we're trying to continue to push our organization to do is that, policy level, organizational level, ongoing efforts. Hopefully our anti-racism committee can, advisory committee, we even renamed it an advisory committee because we wanted our leadership to understand that, it's not the work of the committee. We're here to advise, to provide transparency to our organization, to be able to report back to them, to be able to hold the organization accountable, to say, hey, we've been working on these policies around, reporting incidents of racism in the workplace. Where are we with that? No doubt, Nada really emphasized that this isn't a marathon. No doubt that, transformation, like true transformation, requires a lot of time. And I'll be frank, it also requires a lot of money. People want to say that they're doing this work, but they don't really want to spend money on it. And, to bring in folks that have been doing this work for a long time, they need to be paid for that work. When we're going to, in our next, we're going to embark on really involving more of our patients and more community members who can provide their lived experience. Those people need to be paid. And so it's a transformation a little bit about who's an expert. How do we, engage with, community organizations in an academic health institution? It's going to require some transformational thinking. It takes a little while. I think it's going to take consistent efforts. And that's why I think also that you need to set up a practice where, people change over. There's going to be turnover of staff. There's going to be turnover of leaders, and thinking about how to deeply embed within an institution some ways of really consistently, it's like a nudge, consistently providing a force with which to do this work. And again, I think it comes back to having a understanding, and for the whole organization to understand that this is something that's worth it. This is something that's necessary, and this is something that they're willing to support. And I think when it gets at the core values of an organization, it gets at the key strategic plans of an organization, and it requires leadership to really be deeply committed to this work. I think we're getting there, and I think that I have some optimism within our group. I also can see how there's lots of work to be done, and it requires one to speak up. And like Nada said, it also requires the trust of an organization to see that you're willing to have these difficult conversations, and to see that you're willing to put your money where your mouth is. Nada, do you want to do the last 3 takeaways? Or shall I?
Yeah, so I think just to finish us off, we wanted to come back to these 3 key points. And of course, we've got a little asterisk up there, just acknowledging that this is part of a broader framework for anti-racism interventions in healthcare that we have synthesized in our scope and review. But number 1 is really to spend the time upfront identifying clear goals, defining terms, and making the language explicitly anti-racist. And again, centering anti-Black racism and anti-Indigeneity. Part of this too is the tendency to try to use euphemistic language, right? And use the language of EDI, or equity, diversity, and inclusion, or cultural competency, which are important but different. And I think that attention to explicit, not confusing terms, but actually naming what it is incredibly important. We also think that what we found from other interventions in healthcare settings was this importance of starting with broader level changes. So again, like policies for institutional change, dedicated funding, cluster hiring, etc. This work must be done synergistically. Built-in stop and reflect mechanisms for accountability and transparency are incredibly important. And we hope that in sharing 3 of these issues and kind of like working through the thought process of what our lessons learned were and the strategies and insights that we gleaned from our own experience, we're hoping that this can be taken forward and actually serve as conversation starters, right? Regardless of where you're trying to do this work. And so we just had a little bit of time with you today, but we do have this article. This is the link to the article, and we've also written a healthy debate article. So that can be found at these links. And we want to thank everyone for coming and joining us today. I mean, I think we could keep speaking about this for a while, have a great conversation, but we welcome any questions as well.
Thank you so much for a really incredible project that you are pursuing. I'm going to ask Yuliya, would you mind just stopping the share of the slideshow